Ever since I was a little kid, I wanted to go into nursing. I came in toward the nursing department when I was still in high school, and everyone I met was very friendly, very supportive, willing to show me around the floor here, and I fell in love with it.
The fact that it was close to home, the size, the cost, all had an impact on my choosing here versus the other programs. A lot of the other programs, I wasn't going to get what I needed.
Well, when I came to this department, we only had one program, the RN to BSN program. We didn't start the generic BSN program until 2008. And we are getting ready this coming May to have our 4th graduating class from the generic BSN. With the RN to BSN program, we did receive accreditation for 10 years, and so we'll be up in the spring for reaccreditation, which we expect no problems. And it will also be the first time for our new program to receive accreditation.
The RN to BSN program at Central Connecticut State University has a long history of success. There are courses that are designed to build upon prior education rather than repeating what was learned at the associate degree level. So it prepares students for practice at the baccalaureate level. Every RN to BSN student has an advisor who will guide them in their plan of study. Students progress at their own rate. So there are students that can get through in 3 semesters, and there are other students, because of outside needs such as employment or family, that need a longer span of time to complete their degree.
Prior to this year, the requirement for getting into the nursing program was a set GPA, but since then we've added 2 additional requirements. One is a standardized test, which accounts for 25% of the points. Then second is the chemistry score, which accounts for another 25% of the scores, and the other 50% is a GPA.
I've gotten a lot of help from professors over the years, so I think that's the biggest thing when you have staff that's willing to help and they want you to succeed, they want you to graduate, they want you to pass your NCLEX. That's the ultimate goal. That's the biggest thing.
It's in the central part of the state. It's easy to commute to from anywhere. Again, the staff is great. They provide great clinical opportunities for us that are also close to where you live and can commute to pretty easily.
There's always someone to talk to when you don't understand something, whether it's the professor who's actually teaching the course or a professor who knows about it. Everyone's willing to help you.
I have an 18-year-old daughter, so I look at all the students as I treat them as if I was dealing with my kids. So we talk, so they come in and we talk, they can vent, have a good relationship with them, a great relationship. I love the relationship I have with them.
I chose to come here and teach at Central because I fully embrace the importance of professional nurse education.
So for the senior rotation for the nursing students, they go into the hospital and also into the community setting.
Community engagement is one of the elements of distinction of CCSU. We place a very high value on community engagement as a university. We have taken that value and incorporated into the nursing department. We've also, the past couple years, have a presence in downtown New Britain at a storefront clinic called Community Central, where we hold weekly wellness clinics for anybody that wants to come regardless of their ability to pay or not. They're run by our students and faculty, and folks just come in and can get any type of health services they want.
My best experience was when I had my maternity clinical. My instructor, her name was Millicent Reynolds, and she was fabulous. She just explained everything in detail. She made you think on your toes.
One of the clinical experiences that really left an impression on me was the Mount Sinai clinical, where we did our psych rotation. It was interesting because it was a type of nursing that I didn't even know was available.
When I'm out working as an EMT, I see a lot of different medications, a lot of different situations that as an EMT I'm not necessarily trained to look for. The paramedics, when they know that you're going for a further degree, they let you assist them with whatever interventions they're going to perform on the patient. So if they do an EKG, I get to look at it and I get to see the things that I am learning in class, so it just solidifies the information more.
I taught in an associate degree program, which was a private program. I helped graduate over 600 students. I can't remember half of those students, and it's not because I don't want to, it's because after a while you deal with so many students you don't remember them. At Central we have small classes, and our first class we graduated 42 students. I ran into 2 of those students last Friday who not only knew me by name and felt comfortable enough to come up and talk to me as well as my clinical students, I remembered who they were. And so at Central, you are not a number.
The SNA is the Student Nurses Association. That's a club here we have at Central. So at the NSNA convention, each year we go and we get to meet nursing students across the country and kind of get into your professional role. We get to go to seminars that help you grow as a student and as a nurse in your career.
Getting to know them as individuals outside the classroom and clinical practicum, also getting to know them as new nurses and welcoming them to the profession. So I think that's what's gratifying to me.
I was interested in looking at creating a course abroad, and Central has a relationship with Sam Sharp Teachers College. So one summer when the students from Jamaica were up here, I met with them and talked a lot about some of the opportunities down there. So we decided to try a course abroad to Montego Bay in Jamaica. And this is the 5th year now we've done this over spring break.
You will see different types of populations wherever you go. There's almost nowhere in the world anymore that you can go that's specifically one population. The different cultures, the different religions, they all play a part in who a person is, and to best care for that patient you need to know who they are, what they anticipate from you.
Having that support with the professors has been instrumental in my development. To have that support and to know that they want me to succeed as much as I want to really has an impact on my coming here